A bulky uterus is regarded as the general term for an enlarged-shaped uterus. The uterus turns bulky because it grows during the period of pregnancy. In some non-pregnant conditions, the uterus grows due to musculature, its endometrial glands, and even through its connective tissue. Irregular abnormalities in the menstrual cycle. Heavy bleeding and cramping in the pelvic region, swelling in the uterus, backaches, bleeding in the postmenopausal period, irregular vaginal discharge, pain during sexual intercourse, excess bleeding between periods causing anemia, heaviness around the lower abdomen, palpation of a mass around the lower abdomen, paleness of the skin, general weakness. There are many causes of fibroids. These could be due to genetic changes, hormones, growth factors, and it is believed may be caused by endocrine disrupting chemicals. And genetic. All changes. Many fibroids consist of changes in the genes that remain different from those found in the uterine muscle walls. Hormones. Estrogen is a hormone that stimulates the development of the uterine lining in each menstrual cycle and during pregnancy. In addition, fibroids contain more estrogen and progesterone receptors than typical uterine muscle cells carry. This estrogen triggers the stimulation and growth of fibroids. This is why fibroids tend to shrink after menopause, because of a decrease in hormone production. The bulkiness caused by the fibroids in the uterus exerts pressure on the bladder and rectum, causing frequent urination and rectal pressure. Infertility. Fibroids also contribute to infertility in several ways. Other symptoms of fibroids are heavy and frequent menstrual bleeding, longer duration of menstrual period, pelvic pressure or pain, frequent urination, constipation. 1. Anti-inflammatory medicines. The availability of non-steroidal anti-inflammatory drugs, including ibuprofen and mefenamic acid medicines, helps in reducing the body's production of prostaglandin, which is connected to heavy periods. In addition, anti-inflammatory medicines also act like painkillers. 2. Oral progestogen tablets. Oral progestogen tablets reduce the flow of heavy periods. 3. Surgery. Laparoscopic or sometimes open myomectomy and hysterectomy are the surgical options for removing fibroids. This decision is based on the number and position of the fibroids and the age and fertility status of the woman. Some common types of imaging technology are ultrasound, which uses sound waves to form the picture, saline infusion sonography, which uses an injection of salt solution into the uterus to help create the ultrasound image, magnetic resonance imaging, MRI, which uses magnets and radio waves to create the picture X-rays, which use a form of electromagnetic radiation to see into the body, computed tomography, CT, or computer-assisted tomography, also called a CAT scan, which scans the body with X-rays from many angles to create a more complete picture.